In this week's Cardiology Countdown, we'll cover aspirin resistance, syncope, and balloon pumping in support of PCI. So starting out with this past week, actually, a big news came out of a study looking at aspirin resistance and the effect of the enteric coating that is put on some aspirin preparations. This was a study that Garrett Fitzgerald's group did, looking at about 400 patients, screening them with a 325 milligram dose of aspirin with or without enteric coating. They assessed platelet function with various measures at 4 and 8 hours after drug administration. And the short finding was that there were no cases of true resistance. That is, if they gave uncoated aspirin, they could document an antiplatelet effect in all patients. So there's not a platelet defect in response to aspirin, but what they've termed pseudoresistance is related, they find, very much to the enteric coating that limits absorption of aspirin. And so this is a cautionary note. There have been prior studies suggesting this as well, and not much data supporting a GI protective effect of enteric coating, as opposed to proton pump inhibition that has been seen in multiple studies to prevent GI bleeding and ulcers. So I think a useful clinical warning about enteric-coated aspirin, where we may suggest to patients using uncoated aspirin. Next up is a study looking at the prognosis of patients with syncope. This is, as we all know, a difficult diagnosis in that there are multiple different causes of syncope, often very difficult to pinpoint on the first presentation. This was an analysis of 37,000 patients with the first diagnosis of syncope in Denmark and matched to 185,000 controls where they looked at prognosis. And they found a slightly higher mortality amongst those who had had syncope, a first presentation, about a 35% higher risk of recurrent syncope as opposed to first episode in these patients with one episode of syncope, and about a 5-fold higher need for a pacemaker or ICD, which is probably good news in that they were found to need that over time. They point out that in the so-called low-risk group, that are largely middle-aged patients with syncope, that mortality and stroke and these other endpoints, rehospitalization, are significantly higher. And so it calls our attention to not simply cross our fingers and hope the syncope doesn't come back, but to look a little bit more carefully to be able to identify that cause of syncope. And this week's top pick is a follow-up of a prior randomized study looking at balloon pumping in support of elective PCI for patients with known left ventricular dysfunction. This is from the BCIS-1 study that randomized 301 patients with low ejection fraction, less than 30%, undergoing elective PCI, to having that PCI with balloon pumping or not. And this new analysis looked at mortality out through about 4.5 years of median follow-up and found a 33% reduction in mortality in those who had balloon pump support. Now, there are other differing studies in different populations, but this is certainly a high-risk group where clinically we often turn to balloon pumping in support of a high-risk PCI, and these new data with long-term follow-up lend support to that practice. So for this week's Cardiology Countdown, I'm Chris Cannon.